When life happens and you need care fast, you can teledoc that. Need help navigating big changes? You can teledoc that too. From checkups to check-ins and everything in between, for your physical health or for your mental health, you can teledoc all that. We've got doctors, therapists, specialists, and coaches all available by web or app. Get started today at teledochealth.com. That's TELADOC health.com.
If you've struggled with stress, balance, or burnout, and simply feel discouraged or even defeated, and if you're ready to move from force to flow and enjoy ultimate Zen success in your career, health, or relationships, then the Zen Success Show is for you. Your host, Carissa Sims, is an entrepreneur, corporate consultant, best-selling author, meditation teacher, and healer who has found her own Zen success. Here's your host, Carissa Sims.
Welcome to this week's episode of Zen Success. Today, I have the pleasure of speaking with Donald Kipp. Hi, Donald.
Hello.
Do you prefer to be called Don or Donald?
Either way. I use Donald so when people Google me, they find me and they don't.
Yeah, that makes sense.
Yeah.
Let me share a little bit about Donald. Donald Kipp has practiced natural health care, natural pain relief, and biostructural therapy for over 35 years. He is a best-selling author and educator. Don has helped thousands relieve pain, perform better, breathe easier, digest better, see better, and literally be taller. And I had the privilege of seeing him in action, spontaneously helping someone with their neck. Don is the founder of Relational Medicine and the Neuroenergetic Release, NER wellness system. NER consistently helps people experience healing, higher performance, and significant pain relief in seconds. He has presented his courses to massage therapists, physicians, chiropractors, physical therapists, occupational therapists, I'm an OT, and other health professionals. Whether speaking in front of a large group or treating an individual patient, Don's goal is always to give an experience of rapid and profound change with the intent to expand the human paradigm of what's possible. So, Don, I just wanted to dive in. What is NER, Neuroenergetic Release, and how did you discover this process?
Well, so a little background. In a nutshell, you could describe neuroenergetic release as quantum neurosomatic therapy. So there's an energy component. If I'm working with somebody physically, I usually am touching them, but I don't need to, because there's a quantum connection between us all, between everything. It's informational. It transmits information to a person or to a being, let's say that, because it works with animals, it works with infants. It's not mind over matter.
I see.
At least not the patient's mind over matter. My mind is involved in it.
Oh, that's interesting. So you've helped with animals as well, pets.
Yes, animals as well. So it gives the body information on how to go back to balance, basically. Everyone experiences trauma, physical, emotional, maybe on other levels. They all intertwine and interact. And the body has responses to that, like emergency responses, and turns certain things on, other things off. And on a structural level, physical level, it makes certain muscles weak, certain muscles strong. It changes how people look, how people stand, how they function. Um, and the body doesn't necessarily know how to handle all of that. It's doing the best job it can in any particular moment. And I give it information on how to, to rebalance things. So to go more towards optimal function.
I
And
see.
so, and that's why it produces change in under a second. Uh, I don't know how much under a second because I haven't been able to measure that. But
Yeah, I can imagine that's pretty hard to measure with our current tools. But how do you know you have like abilities where you know what to tell the body to get it back into balance? Or how does that process come through you and get the information to your client?
so because I've been practicing for over 35 years, I have um, I have a science background. I was pre-med undergrad. I decided not to go on to med school because of some of my experiences. Uh, and so I studied various alternative medicine, body work, structural things in particular. Um, and and I went into practice doing those things. Um, and I felt things. This kind of goes to my abilities. I felt things in people's bodies that were nothing that I was taught. It wasn't acupuncture points. It wasn't meridians. It wasn't trigger points. It wasn't uh, various things that you may or may not have heard of, motor points, Jinshin points. It was nothing I'd been taught, but I could feel it. And
Mm.
I'm curious. I'm always curious. And so I was trying to figure out what is that? Because it seems to be pertinent. And from there, uh, I also looked at the body structurally and um, with every patient. So I see physical patterns, shoulder, low shoulder, high hip, low hip, twist in the body, front to back, um, head forward. Those are some of the measurements I look on at everybody physically. Uh, eyes, face and head symmetry, um, all of that. And so I kept looking at those patterns and I'd see common ones and I'd try to figure out again what they meant. Um, and so uh, here, here's something I say to people quite frequently, because we look at things structurally and that's usually on a physical level is what most people are most concerned with. Like if you're in pain, it kind of overrides everything else. Um, but I would look at those things and I began to see these patterns. Um, and I also I had a fairly long history of working with people on emotional level, and I had a, a, a history of my own injuries and some, cognitive training too. So looking at different patterns and how they might present. So I tried and I figured some of these patterns out. I also had a history of working with breath since I was a child in one form or another. As a child, it was like skin diving, free diving, and holding my breath for, over 5 minutes and things like that. Um,
Wow, that's incredible.
and then in my 20s, before this, I did breath work like holotropic breath work, um, rebirthing, things that have big emotional impact often and are transformative. Um, so knowing the power of all these things, I started trying to put things together. The patterns were starting to make sense. One day I had a patient in his 60s. He had 5 ruptured discs in his spine, 2 in his neck, 1 in his upper back, and 2 in his lower back.
Wow.
Standing like an old man, he's in his 60s, and in a lot of pain. And I put together breath, intent, the structure, the patterns, the points that I was feeling. And in a 45-minute session, he changed and was standing like a 20-year-old Marine and out of pain. So that was my patient 1 or patient 0, whatever. And that's where that's where it originated. So it was really an epiphany. I knew this is like nothing that's happened before. There's nothing that could compare that amount of change in that amount of time. And just over the years, I became to understand it more and more. When I'm working with a patient, um, I'm I'm tuning in, but it's more I've built upon all that knowledge. So I know I see certain things. I look at those that structure. I know there's going to be certain things that are affected. I know there are certain things that can rebalance that. Um, so uh, and whenever I've discovered I call it relational medicine because it's about how everything relates in the body, how everything relates to everything. And so it's big picture. It's like really stepping back and looking at the whole forest, not just the trees, the individual trees. Um, so I know a lot now. What happened in that 45-minute session, I'm confident I can do in under a minute. Uh, these days. Um,
Do you feel like you
everybody,
have healing abilities?
it's the abilities I have. I'm sensitive on multiple levels,
Okay.
and I have been getting what I call knowings since childhood. I forgot about them from probably uh, puberty to mid or late 20s. And then I actually had a reading where somebody first words out of her mouth after like looking at a chart and tarot cards and hemming and hawing for a while, uh, not in a good way. Uh, Complicated would be the best description of like my chart. But first words out of her mouth finally were, "You're just so sensitive. You don't realize how sensitive you are."
Mm.
That triggered, as I'm having now, um, my hair standing up on my arms, goosebumps. And I started remembering things from my childhood. And I've been following intuition for the rest of my life. Any big decision is based on that. And I get I use I get messages sometimes when I'm working with somebody, but they're not always real specific. Sometimes I find my hands in 2 places and I had no intent for them to be that way. So I ask, usually only after 1 or 2 times. Now it used to be at least 3. I I ask, okay, why are my hands there? Or or and I ask that lots about a lot of things. Why is this person here? Various things. And then I try to figure, okay, so these are related. There's a reason for my hands being here. How else are they related on a physiological or anatomical level? So I try to bring science into it. Um, so there's both logic and intuition involved, but for me, it's more like openness and um, the buildup of the knowledge over the years. So I don't need to be like in a certain state, or um, things will come as they need. But um, and then it's uh, just a lot of detective work with everybody, because everybody's different. Although there's probably commonalities about 70% of things people are going to share, and then they've got 30% of their own unique pattern.
Interesting. That is so interesting. So would you say, would 30% of your work be done remotely or mostly in person?
These days, I would say it could be 20, 30% remotely and the rest
Mhm.
in person.
Okay.
Um, people have flown in from all over the world to see me, but and the doing thing, like doing it on Zoom, like I kept that on, and before Zoom was, um, what was the Microsoft program? They discontinued it, Skype, or
The
uh,
Skype. Hmm.
yeah, that I used to use when people contacted me from, say, England. we would
Yeah.
do it. We would do a intake kind of uh, to see if it's right for them over Zoom, and I'd show them it could work over the Zoom, and that would usually convince them to spend the money on a ticket to come and see me in person.
Yes. Yes. They wanted to see that first.
Yeah, and um, and I kept most of that kind of under wraps because producing change in person is in seconds is hard enough to believe. Uh, to do it over Zoom is like a big leap. But in during the pandemic, when everything got shut down, uh, I said, "Well, what do I got to lose?"
Yeah.
So I started doing free group sessions, so up to 50 people at a time, all on Zoom,
Oh,
and
great.
and it worked. It was the first one I called the Great Experiment.
Amazing. So, would you share how you start working with clients? Do you analyze their gait, or you don't have to do that? You can just look at them and know what to do.
Um, I wouldn't have to necessarily analyze anybody, especially if I could touch them. I'll pick up enough. I've already seen enough, uh, just face to face, that I can see enough that I'd have something to start with. But if I'm working in person with somebody, or even on Zoom, I'm kind of having them stand in front of me or the camera, and I'm like looking at head, um, head, shoulders, hips, uh, the cranial bones where they are. I'm looking for a high ear or a low ear, high eye, low eye. I'm looking for twist. Um, so I'm doing all that structural stuff, and I record all that, and that that gives me a pretty good understanding of their pattern. And I usually, before that, I'm doing a really thorough intake of their history, going
Oh,
and I'm asking for when things onset, what other things have happened in their life, injuries, traumas, onsets of illnesses. I use that kind of in quotes. Um, uh, 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 Ear infections as infants or babies, uh, um, digestive or eating problems, even going back to birth. So a lot of things are response to birth trauma. So eye infection or eye problems, ear infections are and colic, or even an infant unable to latch on and nurse properly. Those are all signs of birth trauma.
oh, interesting. That is fascinating that you bring it back to birth. I can believe that. So, are you doing this over online, this survey where you're asking people questions, or do you ask in person or over Zoom?
I have a intake, like a 2-page intake form,
Okay.
a history form. It's got a lot of symptoms. It asks some pertinent questions, and
Hmm.
including what they what they expect from their visit. Uh,
Okay.
and but symptoms, primary, secondary, injuries, surgeries, and then there's half a page of just check marks where just symptoms that I would be interested in. From that, then I start asking questions, and that gives me a good background.
Yeah, I see. So, what's the number or the range, number of sessions a client will need to see lasting results? Because I know you said you can create lasting results under a minute.
Yeah. Um, well, it'll depend. For instance, if it's an infant, it may be one session.
Okay. Is that because they're so open?
Um, it's because I believe these patterns that I speak of, the longer you have had them, the more locked in they become.
Oh, I see.
So an infant, it could be days, weeks, months, uh, but not decades, you know.
Hmm.
So, um, so people ask me what's my ideal client. I would say, well, a newborn would be because, we can prevent a whole lot. We can, because all of that will continue
Oh,
for
that's
the rest of their
amazing.
lives if they, but
Yeah. If they don't heal it when they're newborn.
right.
Wow. That's so interesting. So, does a client need maintenance sessions or do you give them additional exercises to maintain the structural integrity of their body on their own?
Yeah, adults do, so like infants might be one session, but adults, it's at a minimum of four, and the average might be five or six or seven, somewhere in there. Um, and um, but the minimum of four is because the 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 patterns have been held longer. They're more um, ingrained. You can actually re-trigger those patterns. Any trauma you experience will tend to put you back into that old pattern. Um,
Oh, interesting.
because it's been established, like in the nervous system, it would be what's referred to as a facilitated pathway, or it's a pathway of least resistance, so it could get triggered fairly easily. And there's things people do in their everyday lives that they have no clue that that can set them back, that are actually harmful to them. And so I have to teach people that. I also teach people uh, a practice several times a day. It takes like 15 seconds each time you do it. I want them to do it a minimum of 3 times a day. And so less than a minute a day uh, to to maintain. But eventually, they're going to need a little help again. I need
Yeah,
a little help, you know, every
everyone
so
does.
often. I put
Yeah.
myself in positions with every patient that aren't particularly good for my body. Um,
Oh, uh-huh.
um, Even though I'm careful, it's just bending over probably too much. Uh,
Hmm.
but how you sit, how you sleep, um, how your car seat is, uh, are some of the big ones actually, and people have never been taught uh, the proper way. And I mean, the proper way, in my opinion, isn't known because the knowledge that I'm speaking of isn't isn't out there. So, um,
Well, hopefully it will get out there more and more.
yes,
So people can learn how to sit. And, it's interesting because I'm an occupational therapist and I worked in injury prevention, working with corporations and helping people with like postural retraining exercises and how to sit and how to adjust a chair and all of that. So I feel like I come from that field, but I probably would be completely enlightened and it was probably be like a 180 from what I think, in my opinion, of sitting or standing properly to what you teach.
Yeah. For instance, um, and I can't tell you, multiple practitioners from different disciplines um, want people to stand up straight, basically. They tell them to pull their shoulders back.
Okay.
That's dysfunctional.
Oh,
It
interesting.
because you're recruiting more muscles. Good
So how are you
posture,
supposed to hold your shoulders?
have an open heart.
Open heart. Okay. So it's more
So
subtle.
so so lift your sternum up.
Ah, I see.
So
Yeah,
you
no one
open up
teaches
your
you that.
chest. Your heart center is open. And that movement is all spine and chest.
Ah, got it. Yeah,
The
that's
shoulders should just fall on top of the ribs when they're and when the spine and ribs are in proper alignment, then the shoulders should just fall into place. So good posture is where you're the most relaxed, using the least amount of energy, the least recruiting the least number of muscles in the most balanced way.
interesting. Well, it sounds very spiritual too, because it's like open your heart, live from your heart, and so I'm wondering if people open up more spiritually too when they start using these postures.
It's my hope they do.
Hmm.
Um, yeah, I think having an open heart is a better way to go through life. Um,
Even though
I
it might hurt more when you
yeah, the
love or connect
yeah,
with
but the
people.
risk, the downside of not taking that risk is you never have the love. So it's
Yeah, it's
yeah.
better to take the risk. Yes, I agree.
So um, it goes to like one of my objectives, expanding the human paradigm.
Mm.
That through all of this, so I used to, for that a period where I forgot my knowings and wasn't getting messages. Um, I was very left brain logical, and
Hmm.
that was all that is, and through all of this, I know. Now it's not like I believe or I think, it's I know everything is connected. I
Wow.
know there's a greater intelligence, um, whatever way you want to call that, whether it be God, spirit, um, quantum energy, whatever. Um, but there is greater connection and greater um, hmm, there's so much more to know than we know, and so much more to be than we know.
Mm.
Uh, so like when I um, change a group of people or an individual in a second or less, and they can feel it in their physical being, they know something beyond what they were believing just occurred, you know. So it can open up that box a little, that paradigm that we live in. And if you when you start, it's most of the time people expand their paradigms very incrementally,
Yeah.
just a little bit at a time. When you have an experience, and that's what my epiphany was, you know, if this can happen, what else can happen?
Mm. Yeah. And part of
Now,
those paradigms, I assume, are you need to go to a medical doctor in order to be healed. You need to have surgery. You need to take medication. It takes a long time to heal. I'm sure there's all, or you can never heal. I'll just live this way. This is the way I've always lived, right? Those are a lot of the old patterns and paradigms.
right, right. And you know, um, there's a lot of things, there is mind over matter. That's what the placebo effect is.
Mhm.
Um, there is, the power of positive thinking. There is having, you're better off with positive beliefs than negative ones, because
Hmm.
they're much, everything starts with a thought, and you're much likely to have a positive outcome if you have a positive outlook and are open to that. Um, but that doesn't mean that's what all that that's the only level, and maybe even the most important. Who knows? And again, people will physically respond to both an emotional trauma and a physical trauma. And I would say every injury, every trauma is both physical and emotional.
Good point.
And I don't I don't decide what percentage that is. That's up to the individual to decide. But
Mm.
people have emotional release. Why we're just addressing the physical symptoms. Um,
So they'll
and
cry
they'll
or
cry.
anger.
Occasionally they'll laugh.
Laugh.
Which is a nice
That's
change. But
charming.
yes,
Yeah.
but or they'll feel something, or they'll remember something. And just like I say that the physical changes in seconds, why not the emotional changes in seconds? So sometimes that that release or that memory, that may be it. You're done with it now.
Mhm.
But you needed the physical to change, even if you had done years and years of, inner work on that, and it still would come up. But maybe now, because the physical changed, that was the last piece that needed to be let go of. So
I see. That's interesting. So, how does it help people have less pain, be healthier, stronger, taller, and you say better looking? That's a big claim.
it's one that catches people's attention.
Yeah.
Um, so most everybody has noticed somebody who has like one eye higher than the other, or one ear higher than the other. So
Hmm.
there's asymmetry in your face, okay?
Okay.
Um, there's been articles written on how we perceive beauty, and they talk about the people who are
Symmetry.
most beautiful are perceived most beautiful have the most symmetrical faces.
Interesting.
So
Yeah.
I change people's faces. So
Wow. To
so
be in symmetry.
to be in symmetry. Yeah, so that can be in a second to a minute can be noticeably different. Um, Also, we express emotions through our face. So sometimes when people are in emotional pain or physical pain, you'll see it in their face.
Yeah.
So if you relieve that, that changes. Um, People go from a pained look to being in ecstatic joy uh,
Wow.
in um, in minutes. And then your whole physical presence. So the taller part is mm, is like your shoulders
Mm-hmm.
straightening out, your heart center opening,
Mm-hmm.
your spine coming into normal alignment instead of having curves both laterally and front to back
Mm-hmm.
in it. So you literally, that's where the tallness comes in. So your spine literally straightens out. So hence you're taller between your pelvis and the top of your head. Um, and you can be all crunched over. That doesn't look so good, but if you're standing up with your heart open, it looks a lot better. So that's some of the ways I make help them be better looking. It
How?
it does it does affect the fine lines and stuff on your face too.
Oh, interesting. So, how do you make a person's face more symmetrical?
Same way I do everything. I give the
Okay.
body information. Mm. Okay, so we're actually talking about bones now, all right?
Okay.
Because they underlie that when I say structure, that's usually measured through bony landmarks. Okay.
Okay.
And so bones, though, are stupid. Bones are only in or out of place because muscles are pulling them that way.
Hmm.
But here's the thing, muscles are stupid too. They don't do anything on their own. They only do what the nervous system tells them to do.
Okay.
So I literally am telling, your left shoulder to go down, your right shoulder to come up, your heart center to open. I'm telling your left ear, your left temple to go down, your right temple to come up. Um, I'm giving your body all that information simultaneously. And actually, the change for the most part has to happen simultaneously
Interesting.
because
Why is that? Yeah, go ahead.
everything's compensating or accommodating
Mm.
some, something else. You hurt your little pinky, your pinky isn't just hurt, your whole body responds to that.
Mm.
Not,
Interesting.
yeah. So um, that's the part that's the information I'm giving the body. How how things are all related, what needs to change, what do you need to let go of? Again, because muscles are pulling, so it's really more about letting go. That's the release part of neuroenergetic release. Um, Now, if when certain muscles are too tight um, or too strong, other muscles in response become too weak, So some muscles become stronger, some become more normal strength, let's put it that way, and release. So, and things like inflammation-based things like tendonitis or bursitis
Yeah.
are because of too much tension on something for too long a time till it
Mm.
gets irritated enough and no recovery that you start getting inflammation. So it's really about tendonitis is muscles that never relax, so they're constantly pulling on the tendon. So the tendon is never relaxed; it never recovers, and you get the inflammation there also.
Yeah, I was wondering if you could walk me through how it might work for knee pain.
Knee pain, knees and hips are, they're big ones because a lot of people have problems with it,
Yeah.
and um, they have joint replacements now. But like you'll almost exclusively without there are cases of people injuring a knee, but without, say, a traumatic injury to knee. They'll wear one knee out before the other.
Yes.
They'll wear one hip out before the other.
And
Now,
then
that
and
might
then
make
they
sense if you walked on one leg most of the time, but you don't. You walk on both.
okay.
So they should wear fairly equal. American medicine has never looked at ask the next question, why? That's what I started doing
Yeah.
39 years ago. So
They
uh,
favor one side.
they use that structure when the head is forward. Now, knees are going to go back to the hips, and you're going to have one hip off most of the time higher. You're going to
Oh,
have them twisted forward to backwards. So that's two planes of movement.
oh my
Then you have
God.
each ilium, each hip bone can tilt forward or backwards from neutral. So those are another plane of movement. So all of those will physical, and then the long bones, the femur, and get involved, and they put more through leverage. They're putting a lot more pressure on one knee than the other, and asymmetrical pressure too. So it's more on the outside or the inside, depending on the pattern. And all of
Oh,
those patterns are what I look at and are actually fairly easy to see. And but not in an X-ray because X-rays don't really do a very good job of creating a three-dimensional model.
yeah.
And uh, like people get diagnosed with leg length difference, and yes, sometimes no. But an X-ray is not a good way of measuring that because they're not controlling for all these other planes. So if you put one side closer to that film or sensor, it's going to look longer than if it's further away.
Oh, that's interesting. Because that happened to me when I was a baby. And I guess it's still in my structure where one leg is longer than the other. And
Probably not.
probably
Probably.
not.
Yeah.
Okay. Yeah. And I think and I also had like a slight scoliosis in my spine. So that could have affected it as well, right?
Yeah, but see now you're dividing yourself up into parts and it's all one being.
Ah, so don't
It's
do that.
not like you have this in your hip and you have or and then you have this other thing and it
Uh-huh.
could be because of either it's because of both. It's because of all
Oh,
the
yeah.
so the spine is big curved because your hips are off.
Oh, interesting.
It
That's
has
the
to be
source. Yeah.
that's what happens to resist gravity.
Hmm. Yeah. Oh, that's interesting. So a lot of people who have scoliosis, that could be the reason because the hips are off.
Yeah.
Okay.
And but it's not the hips so much.
It's oh, okay. Yeah.
So go back to an infant.
Hmm.
I mean, for a year or more or around there, they're not even upright.
Right.
Gravity's not a big factor.
Mm. Hmm.
So things change as we develop, like a lumbar curve, a cervical curve. Um, those are secondary curves. The arches in your feet are secondary curves. They develop as we become upright. Um, but again, going back to an infant, what might get injured the most in birth, even in a normal birth?
The hips
No, on the mother maybe, but not on the baby.
of the baby. I don't know. The head,
Head, neck.
the neck. Okay, interesting. Okay.
Yeah.
So a lot of
So
those origins are due to birth trauma and the neck.
yeah.
Okay, interesting. So, how is your method used for pain relief, injury rehab, prevention, and wellness?
Um. Well, wellness. So far we've been talking about like pain and
Yeah.
structure and things like that. Now, it's the interesting, one of the interesting things is, that's kind of where I started out. I started out with, pain, ruptured discs, back pain, but also
Okay.
migraines, and um,
Yeah. Were you an athlete?
I have been, yes, most of my life.
Mhm.
Um, but um, it was also hard physical work that also contributed to, I had an injury. Um, and that probably, but it was more, and my athletics. So I
Okay.
know now my back injury was because I hurt my head and neck going off a ski jump when I was 18 and landed on the top of my head.
Oh my God, you landed on the top of your head.
Yeah, I
Wow.
nearly broke my neck.
I can't believe you didn't
I may
die.
have broken my neck. I was
Yeah.
18. I couldn't move for a few minutes. Afterward, I could, and so I'm young and male, and I brushed myself off and didn't think too much about it, you know.
Oh, jeez.
But that led to nearly a decade of chronic back pain. I had never put the two together, and but my structure was off and wore my discs out, and
Wow.
and so when I actually ruptured the disc was I just bent over one too many times. Uh, I was working as a carpenter
A
um,
carpenter. Okay.
in the summer between semesters undergrad, and uh,
Yeah,
that's when it happened.
I see.
So, um, uh, but then people started having one instance of, uh, and this is like 4 years after that epiphany. Somebody comes in, I don't remember with exactly what, probably back pain or shoulder, neck, migraine, I don't know. One of those, pain, okay? And she came in and great, she had response, she felt better. She left, she rescheduled. A couple of days later, though, she called and said, ever since I've seen you, I've been feeling great, but there's something wrong with my eyes.
Okay. What
And
happened?
so I go, everything gets better. I have a moment of panic, and and
Oh, what did I do?
and then I get kind of one of my knowings, and sometimes they come as questions, and it's like, well, if so far everything has gotten better, why would somebody's eyesight get worse? So I
That's
go,
deep. I
I,
think you're gonna
I, I
go
go,
deep.
so then the answer comes, I go, and I ask her, oh, do you wear glasses? And she goes, yes. And I said, oh, here's what I think happened. I think your eyesight improved, and now you're overcorrected in your glasses, and that's why you can't see right, because they're too strong for you now. So I
Um,
said, and I asked her, when did you get those glasses? She's just a few weeks ago. And I said, I want you to go back to the eye doctor, get a new exam
yeah.
and check it out. Well, she did. Here's another funny part. They so her vision was definitely better, and they gave her they gave her the exam and the eyeglasses complimentary because they thought they screwed up the first time because they couldn't believe, that somebody's eyes would get better.
Yeah, and especially that fast.
Yeah. So then and before that too, different digestive things would clear up, heart arrhythmias would stop, so I began to realize more and more things, everything is affected. So these
Yeah.
patterns that I've been working with not only are are a reflection of physical symptoms like pain or muscle weakness, it's also internal function affects them. So there's a pattern for digestive problems. There's a pattern for respiratory problems. There's ones if I see the cranial bones, if they're off, for most people, they're off in the same direction. They're tilted or twisted in the same
Hmm.
direction. When I start seeing them twisted in different directions, it's a indication of higher dysfunction. Oftentimes we will see, then I'll start asking about headaches and eye problems, ear problems, TMJ dysfunction. Uh, so um, all headaches are really related to the neck almost, even though we feel it in the head. Uh,
Oh,
and
fascinating. Like
and
increased attention because of lack of alignment.
yeah, yeah. And there, if you are familiar with trigger points, they refer to distant areas. I believe there's points in the neck that actually refer into the brain and cause brain dysfunction. So
Whoa.
I work with a lot of head injuries, both from birth or from traumatic uh, injury. I've had people um, 30 years post like a car accident, and still they have pain, they have different things, they have cognitive problems. They notice improvement in one session.
Yeah, that's amazing. Well, why is being curious important in our healing journey?
Well, so um, curious how things work, how things are connected. I think for me, that's part of spirituality. Um,
Mhm.
but being curious enough to try something new, or to look for more answers. You know, I don't think I have all the answers. I think I have a lot of really important ones, but by no means all of them. And I'd say I'm, I help over 99% of the people who I see, but there are cases, very few, that I don't help. And I still would encourage those people to continue to look, because I think there are more answers. Uh, no one knows everything, and for anyone, the most brilliant, smartest person in the world, there's so much more they don't know than they know. So,
Mm.
and so it being curious enough to say maybe. You don't have to say yes. You don't have to say no. You don't have to say right. You don't have to say wrong. But just say maybe. It keeps you open enough to um, and curious enough to look for more.
Yes. Well, what roles do connectedness, synchronicity, and knowing play in the evolution of human potential?
Mm. Well, I because of being in, empathic, feeling people's feelings, being um, having this intuition, this knowing, this claircognizance, some people call it.
Hmm.
Um, um, that gives me confirmation that there is more, and I just think that is the human potential, to be more.
Yeah.
Um, some some people say, the seed of an apple grows into an apple, um, and you expand that to the maximum. The seed of God grows into God.
Mm.
So I think our potential is unlimited. Uh, uh, I think someday the things I've described today will seem mundane. There will be greater and more powerful things going on. Uh,
Amazing.
human technology.
Yes, yes, I love it. Can you train others to do what you do?
I can train others to do what I do. I've done it. I have them, but there's not. Uh, there was never the success ratio that I was satisfied with, where
Yeah.
people really became proficient. So
Mhm.
so really over 2 decades ago, I stopped teaching, because it takes uh, a tremendous amount of effort and my time to do that, and um, and financially it wasn't working either. So um, and I still needed to practice. I still needed to learn, you know. Um, but uh, I can teach it. I know others can do it. Uh, I trade with one or two of the people I have taught who did become proficient. Um,
Okay.
and but now I'm getting to the point where I want to semi-retire. Um,
Because how many hours are you working now?
uh, well, working, seeing patients is two different things. So
Okay. Yeah, of
I
course.
just this year I just went down to 3 days a week with patients, but
Okay.
those patients those days can be long. Monday was 9:45 to 6:30.
Yeah.
So
Those 3 days are jam-packed.
yeah, and it did, and I don't really market myself. It's like people, it's almost all referral. Uh,
Yeah, I
uh,
know. That's why I'm so glad that I found you and was able to interview you for my show.
yeah,
And
but
what's your Yeah,
But
go ahead.
my biggest goal right now is to teach others, to pass this on.
Okay.
I'll still see patients occasionally, but I'm hoping it's with one of the practitioners I've taught, that if they can't figure something out, they'll come to me. Uh,
Yes.
and we'll figure it out together.
Sure.
And uh, so I want to be able to pass this on, and I'm have plans for an institute to carry it on so it survives me and it's self-sustaining. So it'll
Mm.
be educational and clinical institute. Um, It'll also have a component for occupational and um, um,
Physical therapy.
no, occupational medicine and commercial medicine, corporate medicine, uh, for companies.
Oh, okay.
So I have
Um,
worked in that arena. I used to work. I've worked for a hospital and saw their employees. Occupationally, number one and two injuries are backs and carpal tunnel.
yeah.
And
Yeah.
I would see those patients, and they would recover without any surgery, without any time lost,
Oh my God.
within a few weeks.
That's amazing.
Um, and um, so there's that. And besides, and this goes for sports medicine too, those patterns I speak to, I can look at somebody and know where they're vulnerable to injury. And
Oh, wow. So that's
yeah, so
incredible.
I can look at them, treat them, and they never have you'll prevent the carpal tunnel, you'll prevent the back pain, you'll prevent the yeah, torn hamstring, torn Achilles, all these things that once you understand these patterns are pretty obvious.
Yeah. Yeah. Interesting. What is Zen success to you?
Hmm. Zen success to me would be like uh, um, achieving what I came in this
Mhm.
incarnation to 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 achieve. Um, I believe my work is a vocation. I believe it's why I'm put here. I believe I'm meant to pass it on, and that's my highest imperative. But also personally to just reach that potential as best I can until I'm tired of it and want to leave. So it'll be lifelong learning, lifelong expansion.
Yes. Interesting. Thank you for that. That was really beautiful. It's been such a pleasure connecting with you, Dawn, and learning about NER, Neuroenergetic Release Therapy. I'll put your website and how to connect with you in the show notes. And thanks for joining me on the Zen Success Show, Dawn.
Well, thank you so much for the good work you're getting out about Zen success for everyone. So appreciate it.
My pleasure. My pleasure.
That's it for today's episode of Zen Success. Head on over to iTunes, Google Play, Spotify, or wherever you listen to shows. Subscribe to the show and share with friends. Be sure to head on over to ZenSuccessShow.com to help you on your Zen success journey. And join us on the next episode. May you find your own Zen success in life.